I'm a dentist and I'm terrified of flying. Not a little nervousness, but every time I'm in a flight and there is turbulence, my whole body tenses up. I grip to the seat and I'm just waiting for the next one. And here's the strange part. I think if I was allowed in the cockpit, I would be less scared.
Fear isn't really about flying. It's the moment your brain realizes there's no immediate exit and it reacts like you're trapped, even though you're not.
Not because it's something different, it's the same thing, but being in the cockpit gives me a vague feeling that I have some control. And this sense of control is the main reason that most of you are scared of us. As soon as you lay back in the dental chair, you lose the sense of having control. You don't know what's gonna happen. There is four hands working in your mouth. You can't see, you can't speak. Some of you have gag reflex. So no wonder you are scared. Actually, your body does the only thing it knows to do. It tenses up and it's just waiting for the pain. That's why many times when I just spray some air, patient jumps. Not because it's painful, it's just air. It's because they're just waiting for the pain to start. This is not weakness. This is not being dramatic. This is what exactly my body does when I'm in airplane in 38,000 feet. So let me tell you exactly what's happening, because once you understand it, it loses a lot of its pressure and control. Dental fear comes from two places mainly. One of them is lack of a sense of control. This is what I just talked about, the not knowing, the waiting. The second is even more interesting. A lot of you, especially younger generation, you are never hurt at the dentist. You don't have a bad memory. You're just learned to be scared, maybe from your parents. I have a lot of children coming that parents tell them, you need to be brave. But when they tell you you need to be brave, it means that there is something scary going on, that you need to be brave. So when your brain labels the dentist as a danger, no wonder when every time you come to the dentist, you have some adrenaline rush, you are scared because you don't want to be in danger. Now I need to tell you the real reason I took this video. Most people lose their teeth because they didn't go to the dentist. But why they don't go to the dentist? Not because they don't afford, not because they are lazy, not because they are procrastinating, only because they are scared. So they put things off until it becomes an emergency. So they go to the dentist with pain, and most of the time it's too late to save the tooth. Or in best case scenario, it's more expensive, it takes more time, the procedure is longer and most probably more painful, and that's the vicious cycle. You don't go to the dentist, you have major problem, it takes more time to fix it if it is fixable, it's more painful, and then you have to actually pay more to be out of the pain, and you're going to be more scared next time. So now my favorite part. Remember I said that I'm scared of flying. So if I don't travel for more than a year, I'm gonna be more scared. But if I have some flights during the year, I'm gonna be less and less scared. So the first solution is exposure. You don't have to book for a major treatment. You have to just book just to go to the dentist and say hi and just meet with your dentist. I can confidently say most of the dentists that I know would be really happy if you just walk to the practice, tell them that I'm anxious of the dentist, and can I just meet with the dentist and just sit there for some minutes. They would be really happy to help. The next step is book for a checkup, a simple checkup that nothing is gonna happen. Even if you are scared of x-ray, you can ask them to not take x-ray. Obviously the checkup is gonna be compromised, but the main point of this appointment is not just to find all the things that's going on in your mouth. It's just, the purpose is just for you to continue going to the dentist. In the next appointment, maybe book for something like clean or x-ray or something minor. And ask them, don't be shy, and ask them to tell you what is exactly going on, what's gonna happen. For example, if you booked for a clean, tell them how they're gonna clean your teeth. Most of the time we explain to the patient, but sometimes if we don't know that the patient is anxious, we just carry on. But if you tell us that you're anxious and if you ask us to explain what exactly is going on, we can tell you, for example, this is a scaler, you can touch the scaler, you can feel that it's not sharp, it's not gonna damage your gum, then you're gonna be less scared, because all of this is gonna give you a sense of having control. This is actually a technique that we use for children. This is called tell show technique. I usually show children how am I gonna use my instrument. I can let them touch. So it's the same thing for adults. The next one, I don't know how you're gonna feel about what I'm gonna say, but is to identify as someone is not scared. I just said that I'm scared of flying, but this was mainly for the purpose of this video. Usually, when I'm alone by myself, I don't tell myself that I'm scared of flying. I try to forget about this. I try to think about the final result, about my destination, and I'm gonna be like, oh, this is only 2-3 hours, and then I'm gonna be there, I'm gonna have fun. It's the same thing you can apply for dentistry. You can think about the final result. You can think about the nice teeth you're gonna get at the end. You're gonna think about the fact that you won't have pain. Next one is write it down and hand it over. Let's say, I have seen it usually from men, because men are more shy to tell me, for example, as a female dentist, that they're scared. But I had this experience that during the treatment, the patient had almost a panic attack because he didn't tell me that he's so much scared of the dentist. So what you can do is just write it down. When you come to the practice, write it in a paper that I'm anxious for this reason, or maybe without any reason, and just be more gentle. And we're gonna do our best to help you. The last one is breathing technique. For example, anytime that a patient is anxious or they're gagging for the x-ray, I ask them to breathe deep and keep it and then release, and I breathe with them as well. This procedure makes me as a dentist more relaxed. So if you practice some breathing before coming or during the treatment, it really relaxes you. Come with someone that is encouraging you and tell you that you can do it. Most of the time, when I'm alone with patient and they tell me like, oh no, I can't do it, let's say for x-ray, especially for children, I tell them that no, I believe in you, I know you can do it, and they can do it. Because you need someone to tell you that you can do it, not that you need to be brave. There is nothing to be brave about. It's not scary. Dentistry is not scary. But if you come with someone that tells you, I don't know how you're gonna do it, you need to be brave, I can't watch, these stuff naturally are gonna make you more scared. So it's always a good idea to get some support from family or friends that you trust. And I want to tell you that most of us become dentists not to judge you, not to just rush for treatment. We became dentists to help. So we are not sitting there judging you. We want to help, and it's very rewarding when an anxious patient is engaging, brushing better, coming to the visits. So I hope this video helped you. If you know any other technique, please mention in the comments.